Alzheimer's disease is a complex and devastating condition that affects millions of people around the world. It leads to memory loss, cognitive decline, and major changes in behavior and personality. While there is no single cause for Alzheimer's, several factors increase the risk of developing this disease. Understanding these can help in early detection and possibly delaying the onset of symptoms. Today, we will explore these factors in detail, from genetic predispositions to lifestyle influences. 1. Age as a primary risk factor. Age stands as the single most significant risk factor in the development of Alzheimer's disease. As we age, the likelihood of developing Alzheimer's increases substantially, a phenomenon seen not just as a statistic, but as a reflection of biological aging processes that affect brain function. According to the Alzheimer's Association, the risk of Alzheimer's doubles approximately every 5 years after age 65. By the time an individual reaches 85, the risk climbs to nearly 1/3. But why does age have such a profound impact? Research points to several age-related changes in the brain, including shrinking brain mass, inflammation, and the accumulation of amyloid plaques and tau tangles, which are hallmark features of Alzheimer's disease. These plaques and tangles disrupt communication between neurons, leading to the loss of function and cell death. A study published in the Journal of Neurology provides insight into how these changes contribute to the increased risk. It highlights that as the brain ages, its ability to repair neuronal damage decreases, and the mechanisms that clear abnormal proteins become less efficient, setting the stage for Alzheimer's pathology to take root. Understanding this link between age and Alzheimer's underscores the importance of monitoring cognitive health as one ages. It also amplifies the significance of advancing age as not just a number, but a critical factor in the overall risk profile for Alzheimer's, making early detection and preventative strategies even more crucial for older adults. 2. The role of genetics in Alzheimer's. Genetics play a pivotal role in the development of Alzheimer's disease, influencing both the likelihood and timing of its onset. Among the various genes associated with Alzheimer's, the APOE4 allele is the most significant genetic risk factor identified to date. Individuals carrying one copy of the APOE4 gene are at an increased risk of developing Alzheimer's, and those with 2 copies have an even higher risk, although it's not an absolute guarantee they will develop the disease. Studies, including data from the National Institute on Aging, show that approximately 25% of the population carries at least one APOE4 allele. Yet not everyone with this gene will develop Alzheimer's. This highlights the complexity of genetic influence. While APOE4 increases risk, its presence alone does not dictate the disease's onset. Genetic factors interact with other risk factors, including lifestyle and environmental influences, to affect disease development. The discovery of APOE4 has spurred extensive research into other genetic factors that might influence Alzheimer's risk. Scientists are examining how genes related to brain function, inflammation, and the body's processing of fats and cholesterol might also contribute to the development of the disease. This research is crucial as it helps to unravel the broader genetic landscape of Alzheimer's, which could lead to targeted prevention strategies and treatments. The impact of genetics on Alzheimer's illustrates the disease's complexity and the interplay of multiple factors that contribute to its development. For those with a known genetic risk, genetic counseling and early monitoring for signs of cognitive decline are recommended as proactive measures to manage and potentially mitigate the risk. 3. Family history and Alzheimer's risk. The presence of Alzheimer's disease in a family history significantly elevates the risk of its occurrence in subsequent generations. If a parent, sibling, or child has Alzheimer's, the chances that other family members might develop the disease increase, suggesting a strong genetic component. According to studies, having a first-degree relative with Alzheimer's can triple the risk compared to individuals without a family history. This increased risk can be particularly pronounced if the family member developed Alzheimer's at a younger age, typically before 65, which is often referred to as early-onset Alzheimer's. This form of Alzheimer's is rare and can be linked to genetic mutations in specific genes, such as APP, PSEN1, and PSN2, which are directly inherited and highly penetrant, meaning that carrying these mutations almost certainly leads to the development of the disease. Beyond genetics, shared environmental factors and lifestyle choices within families also play a role. For instance, Families may have similar diets, exercise habits, and exposure to environmental toxins, which can contribute to their Alzheimer's risk. Recognizing the role of family history in Alzheimer's not only helps in assessing risk, but also emphasizes the importance of genetic counseling and early screening for those with a significant family history. Awareness and proactive management can help delay the onset of symptoms and potentially mitigate the severity of the disease. 4. Other contributing risk factors. Alzheimer's disease is influenced by a variety of risk factors beyond genetics and age, highlighting the complexity of its development. Here's a detailed look at some of the additional contributors. Down syndrome. Individuals with Down syndrome are at a particularly high risk of developing Alzheimer's. This is largely due to the extra copy of chromosome 21, which they possess, leading to the overproduction of amyloid protein, a key component in the formation of amyloid plaques found in Alzheimer's patients. Studies indicate that by the age of 40, nearly all individuals with Down syndrome have these plaques, although not all develop dementia. Head trauma. There is a well-established link between severe head injuries and an increased risk of developing Alzheimer's later in life. Research suggests that traumatic brain injury can lead to the deposition of more amyloid plaques and tau tangles, similar to those seen in Alzheimer's. A systematic review in the Neurology Journal reported that people with a history of severe head trauma had a 50% higher risk of developing Alzheimer's than those without such history. Cardiovascular health. Heart disease, stroke, high blood pressure, and high cholesterol are all linked to an increased risk of Alzheimer's. The brain is highly dependent on proper blood flow to function correctly, and these conditions can compromise the vascular system, reducing blood flow and leading to vascular damage that predisposes individuals to Alzheimer's. Diabetes and obesity. Both conditions are known risk enhancers for Alzheimer's. Diabetes, particularly type 2, affects the body's ability to use insulin effectively and is associated with higher levels of brain inflammation and insulin resistance, which are believed to promote Alzheimer's pathology. Similarly, obesity in midlife increases the risk, likely due to associated metabolic and vascular factors. Lifestyle factors, smoking, lack of exercise, and an unhealthy diet also contribute to Alzheimer's risk. Smoking increases oxidative stress and inflammation, which are detrimental to brain cells. Physical inactivity and a poor diet can exacerbate other risk factors, like cardiovascular health and diabetes, thereby indirectly increasing Alzheimer's risk. On the other hand, regular exercise and a healthy diet have been shown to potentially reduce this risk by improving blood flow and reducing inflammation. Each of these factors alone or in combination can significantly influence the likelihood of developing Alzheimer's, underscoring the importance of a holistic approach to prevention that includes regular medical checkups, a healthy lifestyle, and awareness of one's medical and family history. Understanding the causes and risk factors of Alzheimer's is essential for early intervention and prevention strategies. While some factors like genetics and age cannot be changed, lifestyle adjustments can potentially reduce the risk. For those with a higher genetic or familial risk, awareness and regular health checkups are crucial. Stay informed, stay healthy, and join us next time as we continue to explore important health topics. Remember, knowledge is the first step towards prevention.